and welcome to the MedWire News podcast for Medicine Matters Rheumatology. I'm Claire Barnard. In light of the ongoing COVID-19 pandemic, we spoke to Sangeeta Sule about the steps the pediatric rheumatology community is taking to adapt to the situation. Sangeeta is the Division Chief for Rheumatology at the Children's National Hospital in Washington, D.C. in the USA. So, Sangeeta, how has your experience been of treating pediatric rheumatology patients during the COVID-19 pandemic so far?
Our experience is unique. I think this is a situation that no one has really gone through before in these modern times. And so I think everyone is trying to figure out the best way to treat and keep our kids healthy as we go along. What we've done is change a lot of our in-person visits to telemedicine to try to avoid kids having to go outside or be exposed to any sources of infection. So we've done a lot of telemedicine visits. We've also recommended that if kids themselves have symptoms of fever or cough, to contact us and their primary care providers as soon as possible so we can stop their immunosuppressive medicines if we need to. I think another challenge during this time is to limit the number of visitors that come with children. Usually both sets of parents come to a visit or siblings may come to a visit, but a lot of hospitals have put in restrictions on the number of people who can accompany children. And so that is a big change as well for pediatric rheumatology.
So you mentioned about a couple of social distancing measures, so telemedicine and reducing the number of visitors. How has the uptake been among your patients and their carers for that sort of thing?
Almost 100% of our patients have been in favor of that. They, I think, are naturally, the parents and the children are scared about the data that you see on TV and in the news about just how widespread the infection is and how many people are dying from the infection. So most people are very much in favor of the measures that we've done, including the telemedicine. I think most people have been a fan of that. It's a very interesting concept to come to a person's house via an electronic device and do a interview and physical exam via camera. It's an interesting concept, but all of our patients have been really amenable to it. And I think they appreciate it. I think they appreciate the fact that we're doing our best to try to keep them as safe as possible.
And have you encountered any challenges with implementing this telemedicine strategy?
I think one of the biggest challenges in rheumatology with doing telemedicine is so much of the way we make a diagnosis, the way we figure out if a patient is doing better or worse is by our physical exam. We have to touch and feel a joint to see if it's swollen or if there's any restriction in range of motion. And of course, that's not doable on telemedicine. So a lot of it is having children put their hand up next to the camera and see if their joints look swollen, or having the child get close and try to jump or move around and see if they have any restriction in range of motion. So that's a little bit of a challenge in rheumatology, but we're making it work as best we can during these difficult times and trying to get kind of an overview of how our kids are doing.
So what advice do you think needs to be communicated to pediatric rheumatologists during this time?
I think for the pediatric rheumatology community, these are uncharted times, and all of us are working well together to stay on top of the most up-to-date information. Pediatric rheumatologists around the world are a very collaborative group. There have been multiple societal websites, such as the American College of Rheumatology or EULAR, that have put out very specific information on how to help our patients, recommended telemedicine, recommend social distancing. So I think staying in touch with each other, staying up to date on the information is really important. I think our kids are challenged in that they are on immunosuppressive medicines, which of course can lower their ability to fight off infections. And so we need to be aware of latest data that's out there. I think there are a lot of great resources out there. One in particular is from the NIH. the Lit COVID resource, which is at the NIH website, National Institutes of Health website, nih.gov/research/coronavirus. They've cohorted all the published studies on coronavirus, both basic and clinical research. There's also a great recent letter publication from the New England Journal of Medicine summarizing the SARS-CoV-2 infection in children experience in China, which is very uplifting in the sense that most of the children did very well compared to older adults. Most children had mild infections. So I think that is an uplifting message to take away. So those are two websites and articles that I would suggest looking at.
Are you aware of any ongoing research studies on pediatric rheumatology patient populations and infection with the coronavirus?
Yes, so there are multiple ongoing international collaborations about data registries. So basically keeping track of patients in our population who get coronavirus infection and what is their outcome. So a lot of registry studies are starting. The American College of Rheumatology, EULAR, they're all starting these registry studies to enroll these patients and keep track of the data. I think these types of things are important because this is a new experience for all of us. We don't know how the coronavirus will impact our patients. As I mentioned, our patients are at risk because they're on immunosuppressive medicines. So it's really important that we track the natural history of an infection in our population to see how our kids do.
Who should we be speaking to about this in order to further guide rheumatologists in their practice?
I think it's important to speak to each other, to stay as involved as possible and up to date on the literature that's coming out of countries that have gone through this, such as the publications from China and from Europe about the disease process. I think staying in touch with World Health Organization, the Centers for Disease Control, CDC, staying in touch with our infectious disease colleagues is all very important on how to treat our kids with the coronavirus. I think these types of measures, kind of thinking of a global health perspective, are really important in this day and age.
Finally, what do you think the main things are that pediatric rheumatologists should do at this time and recommend to their patients?
I think the main thing I would add is for people to just stay calm. It's definitely scary times. Keep taking your medicines as directed. Touch base with your doctor if you have any signs of fever, cough, sore throat, any signs of a viral infection to get the best direction on what to do. But otherwise, just stay calm, stay at home if you can, and we'll all get through this. I think for our colleagues, it's also stay calm. I think there's a lot of challenges, and we've had to adapt new ways and new technologies of doing our job and taking care of our patients, such as telemedicine. And I think we've done a great job as a community of implementing these new technologies very quickly, and that we'll all get through this. I think we're doing the best that we can, staying up to date, and in the end, everything will work out.
That's a very optimistic note to end on. It's great to hear how well the paediatric rheumatology community is adapting. Thank you very much, Sangeeta, for sharing your experience, and thank you to you all for listening.